Hey friends, welcome back for a new episode of Conversations Life Science Leaders Aren't Having. Today we welcome to the show Howard Berman. Howard is the founder and CEO of Coya Therapeutics, based out of Houston, Texas, where they are developing breakthrough therapies for neurodegenerative diseases like ALS. As I've gotten to know Howard, who he is to me is the embodiment of commitment. It permeates everything that he does. It's why he wakes up in the morning, is the source of commitment to the cause of finding cures for these life-ravaging neurodegenerative diseases. And it started, as he'll share in our conversation, with the journey that his father had and the battle that he had with dementia. We dive into his story and we dive into the conversation around igniting innovation and fueling it in a marketplace that sometimes suppresses it. I think you're really going to enjoy this conversation with Howard Berman. Howard Berman, welcome. I am thrilled to have you as a guest. So first off, hearty welcome to the show.
It's a pleasure to be here with you today.
You heard me do a very brief introduction of you and who you are to me, Howard. I'd love for you to start us off and letting the audience know what you're up to in the world.
Well, I'm with Coya Therapeutics, and I'm on a mission because I've unfortunately been afflicted by a family member who lost his life or declined rapidly because of a progressive dementia. I mean, a lot of people out there have direct connections either with family or friends who have neurodegenerative conditions, whether it be dementia, ALS, Parkinson's. And it's troubling and it's very sad because there's very little that one can do to help those patients, and the family and the caregivers have suffered a tremendous amount of burden. So about 2.5 years ago, I was comfortable sitting and working in a big pharmaceutical company, developing drugs. I'd helped develop a billion-dollar drug and launched that. I was in a very comfy spot. But I was taking my father and I pulled a number of connections to get him in to see Dr. Stan Appel, who's a world-renowned thought leader, expert in neurodegenerative diseases. And my father had this progressive dementia. And fortunately, he accepted the invitation and allowed me to go meet the doctor. And at that meeting, what happened was he said what I expected him to say, was that there was very little that he could do to ameliorate or relieve my father's condition. But at the end, Dr. Appel said, "Why don't you meet me in about a week? And I want to show you some intriguing and very exciting data that we have." So I accepted, and the following week I was in his office and he was showing me what I consider to be some of the most incredible data in terms of neurodegenerative disease. And he actually had clinical data showing that he could stop progression in a disease called Lou Gehrig's syndrome. People know amyotrophic lateral sclerosis. And he had asked me, would I be interested and willing to help him move forward this technology into a commercial enterprise and bring this to further clinical trials in patients. And given the fact that I selfishly wanted something for my father and for other patients, it was a hard decision, but I went back to my wife and the decision was absolutely, I was going to take this burden to start a company from scratch and raise money and incubate a company out of nothing. And we've done that. And now we are a public company, having raised over 20 million pre the IPO, and then with the IPO, close to almost $40 million. And unfortunately, we were the last IPO of last year with this company. My father passed away the week of the IPO. And so it was bittersweet. We didn't develop a drug in time for him, but we've got very exciting things that we're working on that we believe, and we have clinical evidence that is extremely promising for both the ALS and dementias as well.
Mm. It's, I talk to a lot of CEOs, Howard, in the life science industry, and I would say to a person, they're passionate about the patient. I can't think of a single one that I've talked to. And there's something unique about your connection to the work that you're doing at Coya. And I know I've gotten to know a little bit your head of operations, Daniel, also has a personal connection to the work that you're doing. Very personal, he himself and his family. And so it's unique, this deeply, deeply personal connection. Because you've been in this industry for a long time, how is it different? How is the day-to-day, week-to-week, month-to-month different than it has been in the past in a long, successful career, given this deeply personal connection?
Well, let me just say, starting a company and incubating it requires a tremendous amount of work and dedication and energy, and running a public company even more. It's magnified. So in order to do the job, one has to have a true belief and a vision, as well as a motivation, and it has to be personally driven. That's the energy behind what we do. And it's personal for me with my father, of course, but Daniel, he was the first employee I hired. This is a guy, a young man in his late 20s, whose father died from frontotemporal dementia. His aunt died of ALS. His uncle died of ALS. He had a family history of neurodegenerative diseases. And it turns out that his dad had the mutation C9orf, and so did his aunt and his uncle, which give them a 95% chance that they're going to get either ALS or FTD, and or FTD. So Daniel decided, because you think he's an inquisitive guy, he wanted to learn if he had the mutation. Now, can you imagine if you're positive for the mutation in your late 20s and you know that you have a 95% chance of getting these diseases, these terminal diseases that are horrific? Imagine having that knowledge and what you would do with that knowledge. He decided to go ahead and test himself. And unfortunately, both he and his brother are positive for the mutation. So it is a burden that he holds, but it is extremely important that we move this forward every single day in earnest, developing these drugs that may indeed be ones that stabilize his disease in the future or be used to treat him if he ever comes down with the disease. And so it's all a personal mission, and we have to, every day is a day lost. So we need to push forward in earnest, because we just don't have time to waste.
Yeah. Again, there's just something, it's almost, I can feel it viscerally, the urgency, because I've heard the phrase from lots of leaders in the life science space, every minute counts, and they believe it. But you guys don't just believe it, but you're living it, especially in the case of Daniel. I had a chance to hear his story not too long ago, and just powerful, and literally every minute counts.
Absolutely. And so what do we do at our company that is meaningful, that can make a difference? We have biologics that we've developed, and we're really leading the way in using these biologics to modify the biology of a cell called the regulatory T cell. That's really the science of what we're focused on. We're one of the most clinically advanced companies in this Treg immunotherapy space in neurodegenerative diseases. We're really leading the way. And what we discovered, in fact, in most of these diseases, ALS, FTD, the Tregs are compromised and they're dysfunctional and they're not working properly. So we have developed biologics, both as monotherapy by itself, but also in combination, that seem to be making an incredible difference. And some of that data has just been presented at the MDA conference, and some additional data in Alzheimer's disease will be presented next month. So I think the the excitement that we have comes not just from philosophical or theoretical means, but actual from empirical clinical data that we have in patients. And that's what's pushing us forward to bring these further into clinical trials and into larger cohorts of patients.
Mm. And how many people do you have at Coya, whether employees or contractors? How many people are working with you at this point?
We have a total of 7 full-time equivalents. We have a chief executive, myself, a chief medical officer, a chief financial officer, a chief business officer. We've got operations, and we've got manufacturing, and we've got regulatory as well. We also have external folks that we have under sponsored research agreement at Houston Methodist that are doing the preclinical and translational research as well.
And we talk on the show a lot about culture. How do you convey the urgency that obviously you and Daniel hold, that you've shared with others, that you've enrolled others into? How do you, whether it be a vendor, an outsourced lab, full-time employee, how do you as the CEO convey this level, this passion and this urgency?
Well, we were living it, as you said, but I think everybody who joins the company in the first place, they join because of the mission, and they wouldn't have joined from much larger companies that have lots and lots of capital if they didn't believe not just in the vision, but in the clinical data. So they come into the company with the DNA of someone that is driven by our data, by our cause, by our individual stories, and who believe that they can make a strong impact in pushing it forward.
So it doesn't feel, just as you're describing, it doesn't feel like a big leap. Like there's no arm twisting, there's no convincing. When they walk in the door, they're all in. It sounds like
they're all in because they see what we've done in terms of our clinical data, and they know that we are actually at a seminal point in development of new therapies for neurodegenerative disease, that we may not be making an incremental, but an actual exponential improvement in care for these patients. And that is something not to be taken lightly. And that's why people want to join the company. But again, we're very selective and conscientious on who joins because we want to have the maximal impact with those that are and have the same DNA that we have, the same vision and the same passion. And that's a special kind of person.
Yeah, indeed. Howard, one of the things we like to do on the show is pull the curtain back so our audience can really get to know you. And you've already done that by sharing the story of your dad. I'm curious, would you tell us more about him, about your dad? Like what made him so special?
I'd be very, very proud to do that because it would honor him in his memory. My father was a brilliant guy, triple board certified physician, born in South Africa, born into poverty in the shtetls of South Africa. And he moved to the United States at the age of 40 years old. And he did so because my parents couldn't live with the thought of the apartheid regime, and they wanted to give the children, us and my 2 siblings, a better life in the United States. He moved here at an advanced stage, and he became triple board certified in rheumatology, endocrinology, and internal medicine. I mean, there's many letters when he retired at the age of 78 of people saying that he saved their lives, and if it wasn't for Dr. Berman, they wouldn't be around, and they blessed him. It was very touching and emotional when I found these letters. But my father, his intellect was what made him who he was. He was someone who read voraciously and who loved his family immensely and who had a passion for writing and expressing his thoughts, which made it even more tragic and painful to watch the slow decline. day after day, month after month, year after year, becoming not the person that he was, and losing many of the intellect and much of the intellect that he possessed. And we didn't live that experience by ourselves. I mean, it was among extended family and friends, and a lot of other people, they lived that same journey, and it's a very tragic and sad journey. And when it doesn't, it's not an overnight thing, but it happens over time. So you're literally stripped month after month of personality and emotion and cognition and the way that they think. And so taking a brilliant, loving, I'll tell you one thing that never changed is his love for his family. It is unbelievable. You may lose much of your memories, and you may lose, your sense of many aspects of your sense of self, but your actual recognition of your wife and the love and the inherent love for your family remains, even all the way until the end. And that's what we noticed. And I'm honoring my father by doing the work that I'm doing. And I only want to make him proud and be the best person I want to be, but hopefully alleviate the same sort of pain that afflicted us for future generations and other families.
Yeah, thank you for sharing that about him. I'm wondering, is there an experience or memory with or about your dad that you can point to that shaped, that you can see the fingerprints clearly on you and the person that you are today?
Right. Absolutely. My father believed in hard work and never doing things half. You always have to go all the way, and you have to go in hard, and you have to be the best at what you do. If you're only mediocre, it's not good enough. And he instilled that not just in me, but in my siblings as well, which is why my brother went to MIT, which is why my brother became, the head of MD PhD and the head of a large pharmaceutical company. And my sister's doing very well as a breast imaging radiologist. My mom's a world-leading expert in cancer epidemiology. We're all high achievers, and it's part of it, and a lot of it's because of my father and how he drove us. And it's that motivation, and it's that inherent push that I have when I wake up every day that gets me to do what I want to do successfully in a very difficult environment where you're starting companies from scratch and you're having to build them, and you're a public company, and you're on the calls all day long, and you have to just talk to investors, and you have to talk to the sell side and analysts. It's not an easy thing to do among a small group of people that we have at the company, but I do it because I have that vision, that tenacity that I learned from my father.
Well, thank you again for sharing who he was to you and to your family. It's a real blessing for us to hear that. Howard, the name of our show is Conversations Life Science Leaders Aren't Having. And certainly I would say even these first 15 minutes, these are conversations that typically people aren't having. When you hear me name the show, Conversations Life Science Leaders Aren't Having, what's the first thing that comes to your mind?
Well, I think life science leaders need to know, and that they're not really talking about it, is creative thinking that is backed up by passion and energy, which I've just told you the story about why I'm passionate and energy, is what will make you successful in a very difficult market climate where there's very little access to capital and resources. And you have to have that DNA and that permutation and that combination of elements in order to be successful. And when I say creative thinking, life science leaders need to know how to differentiate themselves from other companies. And they need to know how to act creatively or think creatively out of the box in order to attract investors or to think about consolidation or think about merger and acquisition, or think about in or out licensing. And I think one of the issues that's been occurring is that there are a number of large institutional investors that back companies, and there's a lot of companies out there. So many of those companies don't have access to those pedigreed investors. So there has to be a mechanism for many other companies who have valid technologies and therapeutics to go and access capital. And so my theme is, when I listen to the subject of your show, is by thinking creatively and out of the box and using the passion and the belief of their technology in order to go and attract that capital and be successful to develop their products.
The word, I think we even used it in an earlier call. This feels like the democratization of innovation, the democratization that starts to open up opportunities even for the little guys. Is that still a good word for us to use here?
I think it's very good, because and I'll give you an example. There's a lot of fragmentation in the tech transfer, for example, in academia, where there's a lot of therapeutics and technologies that are moving through their tech transfer offices, which hold a lot of potential for commercial opportunities and also raising capital. So democratization occurs when you have a scientific know-how or knowledge to go to a tech transfer center or multiple centers and find what are the best drugs out there, or therapeutics or technologies that are available for in-licensing, where you are able to leverage that to go and raise capital. And unfortunately, there's no central database of technologies. They're out there. They're like gold that are sitting on the ground, but you just have to sift through the ground and find it. So it takes some innovation, it takes knowledge, it takes scientific skill sets, it takes business development, but it exists there. And it's open for even the billion-dollar institutional companies, investors, but it's open for even the people that are trying to find the next asset to start a company for. So it is democratizing life sciences, because it's driven by the innovations of academia.
And who are the people that that really need to have that conversation? Because guys like you and I, we can have it, and you probably have much more clout in the space than I do. And who are the ones who especially need to be talking about it so that we can start seeing change?
Well, I think the younger generation, the MBAs and the PhDs coming out of university and grad school, and I think those are the people that need to know that a whole world exists out there of innovation if you are willing to go and identify and locate it. And I think there should be courses and classes taught specifically on tech transfer, commercialization, licensing, business development, how to incubate and start a company, how to raise capital, how to take a company to the next level. I mean, that's really what will drive the next generation of innovation, because many pharmaceutical companies now are relying on the smaller biotech companies to innovate and then to be acquired.
You talked about it's this combination of realizing the possibility as well as really cultivating the passion and the purpose. As you were describing it, it feels like that it's the combination of these two things, of not falling into this mode of just the standard way. Well, this is how we've always done it. How have you seen this? How have you seen where people have successfully been able to break away from, well, this is how funding works, this is how it's always been done? What have you seen in terms of what works in breaking away from a script like that?
Yeah, well, the traditional model is that a large institutional venture fund or investor will help either fund and incubate a company. They will be involved in hiring or supporting the CEO, and that's at the baseline. That's when the company gets founded or at a relatively early stage in the company's life. But there are very few investments made relative to innovations in companies that want that. So that's a very small percentage of biotech companies that actually want to be funded. That's a traditional model. And you typically see large investments in these companies, which are syndicated by groups of institutional investors. They usually move together because they invest together. And sometimes they invest with the venture arms of the pharmaceutical companies. And they come in and they invest. And that company then has $100 million to work with. So that's one model. And that's the standard model, the baseline model, which very few people can achieve because it's just not available for many people. There's another model by which and this is the model that we took, is that while you don't do it on at quite as a large scale as that early on and be diluted, because you are diluted when you raise more money early on, you don't own as much as your company. There's another model by which you go out to still institutional investors who you've either worked with before or who are willing to invest smaller amounts of money. When I say smaller, we're talking individually 3 to 5 million, and you syndicate those transactions from a number of smaller institutional investors, and you bring in high net worth family offices and billionaire family offices and those sorts of individuals, and you can raise $20-30 million like that. And it's much higher likelihood of doing that model, in my opinion, for most companies than going and getting $100 million financing from the traditional venture funds. And in order to achieve that money from that second option, you have to have the DNA of an entrepreneur. You have to have the passion. You have to have the science. You have to have the technology. You have to have experience, because they're all looking at your management skill set and whether you have been there and done that before. But so that you can't just get the money without showing and proving that you're being fiduciary with their money and that you're going to achieve success like other successes that you've had in the past. But that's a second model, and that model is the one that we followed. And our investors have been very, very supportive of us, and they've allowed us to go public in a difficult market climate. And so now we are a public company. We've got a good balance sheet, and we've done it the non-traditional way, but we've got very superior science, and that's ultimately science rises to the top, which is going to allow us to be successful.
My curiosity always goes to how, as a result of this journey, this has only been a 2-year journey. This is a very short period of time. How have you changed? How has this process of going through the revelation that you had as you were walking with your dad and ultimately founding Coya, walking the path that you just described in terms of getting your legs underneath you and the funding, ultimately going public. How have you personally changed because of these last 2 years?
Well, I've become more confident than ever. And I've really learned that if you believe in something so passionately and you're driven by a cause, then nothing anyone can say to you can sidetrack you from your mission. And I've learned to have thick skin, and you talk to a lot of investors and you talk to a lot of people. So I started off with thinner skin, and I have much thicker skin and less hair as well. But that's all a function of being an entrepreneur, because if you want to achieve the successes as an entrepreneur, you've got to go through the pains, and you've got to be willing to go through that. And if you're not willing to sacrifice, and you're not willing to work any and all times of the day, and even at night, and it's just not for you. And I wouldn't recommend this journey for anyone. It's just not. It's not the easy lifestyle that and the glamorous lifestyle people think to be a CEO of a public company. No, it's hard, very hard work. But I think that for me personally, it's been a wonderful journey, and it's taught me even further that I am on the right track, because with the loss of my father, I'm very passionate about trying to find things that can ameliorate the disease. And this is almost like a gift from God that I'm on this journey, and it's almost meant to be that I'm here. So I want to also teach my children. My son is going to university this upcoming year. I want to teach him that it takes hard work, and that nothing is handed to you, right? And that you've got to put your passion and your energy and your focus, and you don't let anything distract you from the final goal, which is to achieve success.
Mm. And who do you see yourself becoming? I hear who you've described yourself as experienced, and how you've changed because of the last 2 years. Who do you see, if you and I are having a conversation in 5 years, and of course, we hope in that conversation we're talking about massive breakthrough in neurodegenerative disease, and what are you going to be saying to me in 5 years of who you have become because of the previous 5 years?
I want to be self-actualized as a person who started something and actually took it to finality and conclusion, who brought a drug to patients that significantly made a difference in their lives and their caregivers' lives. That's what I want to be known as. But I don't need kudos for it, and I don't need recognition, and I don't even need this title of CEO to be used as hyperbole that I was a CEO of this company or that company. That I don't need that. I want to be known as someone who's done something meaningful for the world, and it was inspired by my father, and it was inspired by all the patients that decline on a daily basis from these terrible diseases. And if that's the legacy that I can leave behind, it would be everything to me, and it would be meaningful for my family as well to see that. I just want my kids to be proud of me, and I want my wife to be proud of me and my family. And that's what would make me proud, is to leave a legacy behind and not be stuck in any sort of ego-driven recognition. I don't need that in my life.
Yeah, I love that. Thank you for that. Our final question, and I'm sure we could continue talking, but we'll cap it here for now with this last question. If you could seed one conversation in the minds and hearts of life science leaders across the globe, I'm going to give you the wand, and you get to do this in this moment. And they were going to have one conversation over the next week, maybe whether it be a reflective conversation with themselves, with their team, with their family. What's the one conversation that you would love all of these leaders to have in the next week?
I would like the life science leaders to ask their employees, why are you here? What's important and what's critical for you as someone that works for a company? And where do you want to be in 3 to 5 years from now? And I want them to ensure that their mission, the life science leaders' mission and passion, is consistent with their employees. And it should be consistent. Because if it's not consistent, then those leaders, there's maybe something they need to change or do differently. Because the only way that you have success is by working in unison together and working towards a common goal and working with the same passion and energy, whether that's a small company or whether it's a big Eli Lilly or whether it's AbbVie. The CEO needs to make sure that his employees or her employees are as passionate about the final end goal in whatever they're working on as they are, that CEO. So that's an internal discussion with the CEO, and however the CEO finds that answer, he or she needs to get to that conclusion.
That's so great. I love that conversation. I wish we could be a fly on the wall for those that are inspired to have the conversation in the coming week. Howard, if people want to know more about Coya, about you, where can they find you?
Well, our website provides some detail. It's Coya Therapeutics, COYA Therapeutics.com. And we, of course, we're back in the social era, I guess, with Instagram and LinkedIn and all that, Facebook. But that will give you the most information about our company. We are a public company, as you know, and our stock symbol is COYA. And so we are, we are constantly pushing forward. We have lots of news releases that are coming out and continue to come out. So just keep following what we're doing in this journey, of course, this passionate journey that we all have to treat these devastating diseases.
Awesome. And we'll put all of that in the show notes, and so that they can folks can find you if they're interested. Howard, thank you so much for this just really wonderful conversation. Thanks for bringing your heart.
My pleasure, and I thank you.